Hello, everyone. Good evening or good morning, wherever you're at. My name is Nav Grewal, and I'm a pelvic floor physiotherapist at Kaya. And welcome to our chat tonight. So I'm just going to give it a couple of minutes, actually, maybe a minute or so, because we do have quite a few people joining us. So if you need to grab some water, tea, a drink, whatever it may be, go ahead. And I'm just going to chat about kind of like the features if you haven't been exposed to Zoho before, okay, and kind of like what the layout of the talk is going to look like tonight. So you'll notice there on the left-hand side that there is a couple of different things. So one is questions. So that's a box where you can put in any questions that you would like to for me, and these can either be, visible to everybody or not. So when you actually put in the question, that's going to be just visible to me. If it is something that pertains to a lot of people, I'm just going to make it public. If it's a private question, I'm going to keep it private. And then we have the chat box. So that is now live. So if you want to put in kind of like where you're from, what brought you to this talk, you can go ahead. In general, so you should only be able to see myself, and everybody else will be kept private, so you won't be able to see each other. But you can kind of like introduce yourself if you so choose to in there. And then we have the notes on the side there as well. So that's a region where you can type any notes that you want to, and then if you press send, that's going to go directly to your email. So you don't have to write anything down unless you want to. And then finally, we have the mic. So if you click on the mic, that'll kind of like raise your hand. And then, if you do want to verbalize anything, I can kind of allow you to. And that's more so we can keep towards the end if you have any questions or if you want to share anything. Okay, so slowly people are starting to come in. And as they come in, they can kind of like join in wherever I'm at in terms of the presentation. So today we're talking about reducing pain, okay, and any other symptoms, which we're going to go through, preparing for labor and delivery, and then recovery postpartum through virtual pelvic physiotherapy. Okay, so a lot of people, as we know, COVID happened, and then a lot of practices did transition to online. A lot of people are more so aware of medical practices and going to, either seeing the doctor virtually or on the phone. Pelvic physiotherapy and physiotherapy in general also did transition online, and actually, it has been online even before COVID. It's just when COVID happened, we were met with a need of having to, provide continued care for our clients. And a lot of physiotherapists actually ended up going offline because they were scared that they couldn't provide that same type of care. I, on the other hand, because I do specialty care, so I'm doing pelvic physiotherapy, women's health, I actually treat men as well. I ended up going online and treated 100 women in the time frame of when the clinics were closed. So that was over about 2.5 months. And that's kind of like 100 women doing repeat visits. Okay. And we were doing a lot of managing symptoms, reducing and eliminating symptoms, preparing for labor and delivery, postpartum care, taking care of, any postpartum issues that might come up. And those are kind of the things that we're going to talk about. So today, the structure of the presentation is going to be, first, let's just talk about the pelvic floor. Okay. And then after that, we're going to talk about, what kind of signs and symptoms can come up either during pregnancy, and this is also outside of pregnancy as well as postpartum. Okay. And how physiotherapy can help, what a virtual session looks like, right? Because you're probably wondering what that entails. Okay, and then I can answer any questions that you might have. In terms of myself, okay, so my name again is Nav, and I am a pelvic floor physiotherapist here in Canada. So I'm practicing in the provinces. Provinces is equivalent to state of Alberta as well as Ontario. Okay, so that's where I can see clients specifically for physiotherapy. I'm also a women's health coach, and so I do see clients, all around the world. So if you are, outside of those provinces, that would be an option for you. If you so choose to, if you're just here for information, that is totally fine too. And I dove into pelvic health and women's health right after graduating from physiotherapy school, but because there was such a need for it. We are not taught women's health in school, which is a travesty, I think, and it is an underservice. It's a disservice, really, to women. And so I had to take these extra courses, and then that's my practice, honestly, for over the past 5 years. And I just find that it's so difficult to find someone that does women's health, that understands, what it is that you're going through during pregnancy, how to prepare for labor as well as postpartum. And I'm helping women now, all over the place, in person as well as virtually. Okay, so first thing first, we're going to talk about the pelvic floor. But before we do that, I just kind of want to take a little bit of a poll and see where you guys are at. So I'm just going to start this poll. You should see something come up. So which one applies to you? And if none of these apply to you, you don't have to answer it. But are you outside of pregnancy, no children, currently pregnant? Or if you are postpartum, either immediately, several months, years, that kind of thing. Okay, so I'll give you kind of like a few seconds to answer that. Okay, perfect. And that actually helps me kind of like tailor the presentation as well. Awesome. Thank you so much. Okay, so let's go through the pelvic floor. So what I'm going to do here is I'm going to be sharing my screen. Okay, so you're going to see a picture pop up of the pelvic floor in a second. There we go. Okay, so all of you should be able to see that right now. So that's just showing somebody standing sideways and we're looking in, okay? So at the front there, you'll notice the pubic bone. And if you don't see this, just, put that in the chat box. At the front is the pubic bone. At the back, we have the spine, which ends in the tailbone, okay? Right behind the pubic bone, we have the bladder, uterus, and bowel, unless you have had any kind of surgeries to remove any of those organs. And then in blue here, the bright blue, kind of like light blue, I guess, are the pelvic floor muscles. So they go from the front, the pubic bone, all the way to the tailbone, and they basically support all the organs inside and they act as a sling. So these muscles are different than other muscles in the body. Okay, so as I'm sitting here, right now, certain muscles are working, but my legs are pretty relaxed, right? Pelvic floor muscles work 24 hours a day. The only time they are supposed to relax is when you go to the bathroom. Okay, so that's for urination, that's for bowel movements. If they're relaxing at any other point in time, that can lead to leakages. It's either, stool coming out or, urine coming out. Most likely, most often it is the urine coming out, but that's an indication that something might be happening with those pelvic muscles. Okay, and the big thing that I like to just drive through is that the pelvic floor is not just one muscle. I know this makes it seem like there's only one muscle there, but the pelvic floor is actually constitutes a bunch of different muscles. So you should see a different picture now show up. Okay, and that's just showing somebody lying down with their legs open and we're looking in. And that just shows you the depth of the amount of muscles that we have inside. Okay, so you can see the vaginal entrance there, you can see the anus there, and in between that is actually the perineal area. So we're going to talk a little bit about that as well, because perineal massage has been, shown in some studies to help prevent tearing and reduce the amount of tearing during labor and delivery, especially during first pregnancy. And so that area is just very important, but you can just see the amount of muscles that we have inside. Okay. And the most important thing that I like to talk about is how the pelvic floor is a part of the core. The amount of people I have coming to me postpartum or during pregnancy asking me, can you give me some core strengthening exercises? Usually they're pointing to their abdominal muscles. Okay. The pelvic floor is much more than that. So the pelvic floor actually is a part of the core. Okay. And so let me know if you can't see these pictures popping up. So this is someone standing sideways again, and this is the core. Okay. So again, at the bottom, the pelvic floor muscles. At the top is this huge breathing muscle. And I'm always talking about breathing and the importance of breathing and how to use our breath with doing, Kegels, massage, doing different exercises, because that can make you stronger and help to actually relax the muscles and strengthen them at the same time. So that's a very important muscle. The transverse abdominis, not a lot of people have heard about. This is also part of the core. Okay, this is the deepest abdominal muscle you have. It wraps around the spine like saran wrap. Okay, and it is the one that can really help to prevent as well as treat if there's any abdominal separation, along with the other core muscles as well. And then the multifidus there is just showing the little back muscles. Those are all part of the core as well. And I would also argue actually that the hip muscles are a part of the core. So just anything in this area and surrounding the trunk, that is a part of your core, and the pelvic floor is an integral part of that. Okay, so what does the pelvic floor actually do? So yes, it does support. So I'm going to just stop the share for this so you guys can kind of see me again. So it does support the pelvic area. Okay, so it's just kind of like providing that little support to the organ. So that's the bladder, that's the bowel, that's the uterus. Okay, it's kind of like the final frontier before everything kind of like, like for urination or bowel movement stuff can come out. But it is also part of sexual function, it's part of bladder function, bowel function. Okay, and then in general, with mobility, it is always supporting you. Okay, so if you're doing any type of movement, physical activity, the pelvic floor is always working and it is meeting the task, meeting the demand. Okay, so if it's a harder task, it's working more. If you're just lying down, it should be working less. Okay, so that is the pelvic floor. Okay, if you have any questions about that, you can put that in the chat box. Okay, and I will try to kind of like address them as we go along, or I might leave them kind of towards the end because I'll be covering it anyways. So let's talk about common signs and symptoms you should be looking out for. And this is honestly outside of pregnancy, it's during pregnancy, and it's also postpartum. Okay, and the reason I say that is because the youngest patient I've had was 15 years old. Okay, actually, two of them I remember. One was 15, one was 17. And the 15-year-old had leakages. Okay, and she came in saying, at school, my friends try to make me laugh because I'm having these leakages and because they know she's going to leak because of that. And I was like, oh, that's kind of, like, that's not nice. And so we ended up treating that successfully. The other client I had urinary urgency and frequency at the age of 17. Like she could not sit through class. She had to leave multiple times in between classes, same thing. So it's just important to know that even though we're talking about signs and symptoms of the pelvic floor, yes, definitely it can happen during pregnancy as well as postpartum, but it can also happen outside of pregnancy. Okay. And this might be when you're younger. This might be, if you have never had children and it's around menopause or later in life or, in your 30s, where it doesn't matter. Okay. So just some signs and symptoms to look out for to know when to seek help. Okay, so first one is leakages because we've all heard about leakages. So let's talk about leakages. So I used to say before, okay, because it's quite normalized that, leakages are common but not normal. So I don't say that anymore. Okay, it is quite normalized in society, but I just don't like to say that, if you have leakages, you're not normal. Leakages definitely are common. The pelvic floor is supposed to support so you don't have leakages. If you have leakages, there are ways we can treat that issue. Okay. But it doesn't mean that, like you are abnormal. It's just the muscles aren't working the way they're supposed to. Okay. Because the muscles inside are supposed to close, contract, and hold everything in. Okay. And if they're not able to do that, whether it's a cough, laugh, sneeze, physical activity, if you're just sitting around and a few drops are coming out, if any amount is coming out, it means the muscles aren't doing what they're supposed to do. Unless you go to the bathroom, you sit down, and you voluntarily relax them and let them go. Okay. And that can actually also be with the bowel area as well. Okay. I see this less so, but definitely I have had clients come in and they're saying, I will, same thing, cough, laugh, sneeze, or it just comes out like I don't have any control over it. Okay. So it can apply to the bowel area as well. Along with that, urinary urgency and frequency, as well as we call it fecal urgency and frequency. So that's kind of like more the bowel area. So bowel urgency and frequency. So if you feel like, so during pregnancy, let's just talk about that in a second. It is common to go more often, right? And even so outside of pregnancy, they usually say about 5 to 8 times a day. Okay. It depends on obviously how much you are drinking as well. But if you're going, 15, 20 times a day, I would say that's probably an issue we should look into. If during pregnancy you're feeling every 15 minutes you have to go, you feel this constant urgency to go to the bathroom, you're rushing to the bathroom, sometimes you can't make it there in time, or if you put the key in the door, and this is and this may sound silly, but I see this a lot. You put the key in the door and when you come home and you're like, oh my God, I have to go to the bathroom. Those are all signs and symptoms of definitely urinary urgency and frequency and also bowel urgency and frequency. Okay, so that is kind of the bladder area and that's the bowel area. Okay, the final thing with bowel would be chronic constipation. Obviously, there's so many different things that can cause chronic constipation. Okay, and so if you are experiencing that, then it could be, like fiber diet, any type of sensitivities, that kind of thing. But if you have dealt with all of those and you're still experiencing chronic constipation and you're especially having to strain, and I would highly recommend trying not to strain. I know it's hard. I've had dealt with chronic constipation as well, and I make an effort not to strain because that can lead to other things such as prolapse, which we're going to talk about. But if you're finding that you have to strain, it might actually be your pelvic muscles are getting super tight around the rectum, and the more you strain, the tighter they can get, and then you have to force it out, which can be a vicious cycle. Okay, so that's just something to keep in mind. If that's happening to you, I would recommend having your knees higher than your hips. And you're probably like, okay, how do I do that? So if your toilet seat is low, you're going to just lean forward, have your elbows or arms on your knees, take nice, big, deep belly breaths. Okay. If, on the other hand, your toilet seat is quite high and that's not an option, then you're going to use a stool underneath your feet to lift up. Okay. That angle is so important in helping to relax the pelvic floor. Okay. Because you're basically kind of like going into a squat. Okay. So if that's happening, just try that out and see how it works. If it's still not working, then there are other techniques that we can use through pelvic physiotherapy. Okay, let's talk about pain because this is a big one that we see. Okay, so pelvic girdle pain, okay, which is kind of like a wide term. That's kind of like anywhere around kind of the trunk area. So this could be low back pain that you're experiencing. Okay, it could be tailbone pain. It could be pain in the kind of like the bum muscle area. Okay, it could be kind of like sciatica as well, groin pain, lower abdominal pain, pubic pain, pain with intercourse. Did I forget anything? I think I covered most of them. Okay. And hip pain on the side of the hip. So that's kind of like 9 different things. Okay. And so everybody kind of like knows about low back pain. That could be actually related to your pelvic floor. Okay. Or the core. Okay. It just depends on kind of like which muscles are compensating. Certain muscles might be underactive, certain muscles might be overactive. So it just kind of like depends on what's going on, but that is definitely a pelvic floor issue. Okay. Same thing with hip pain and groin pain. Pubic pain usually feels like someone's sitting for a long period of time and then they go to stand and walk, they start to feel it. Or if they're lifting their leg up, putting pants on, rolling in bed, that kind of thing. And it usually feels like tenderness if you press in that area, or it just feels like the bone is bruised. Okay. And it feels like this like a lightning crotch pain. That's usually what my patients are describing it as, or bruised. Okay. Tailbone pain is point pressure on the tailbone. Okay, which is like the last part of the spine picture that I just showed you guys. And that can happen if you're just sitting for a long period of time. And long period is kind of like, like whatever it is for your body. So for some people, it could be, like 5-10 minutes, it could be 20 minutes, it could be a 2-hour car ride, it could be like going on the plane, not going on the plane that much anymore. But any period of time where you feel like you are sitting and it just starts to get so uncomfortable in that area, that usually happens to me on the plane, then that means that either the tailbone isn't moving. This is going to sound weird. Tailbone's supposed to move. So when you're sitting, it's supposed to kind of like curve under. And if it's not moving properly, that can cause it. Or the muscles are just getting so tight inside that they're cramping, and that can lead to it as well. Or you might sit for a period of time and then you might feel it when you're going from sitting to standing. So all of those apply to that. Okay. Um, so those are kind of like the major types of pain in the pelvic girdle. The final one I want to talk about is pain with intercourse. So pain with intercourse I see all the time. I feel like most of my patients come in and they're saying, why is this happening to me? I feel like this is not happening to anybody else. I would say this is happening to a ton of people outside of pregnancy for sure, who have gone to the doctors and, been like, oh, I have this pain. Sometimes they're referring to pelvic physiotherapy, which is great. Other times they're saying things like, just have a glass of wine, it will help you, and which I think is awful, because those people have already tried that, first of all, and might not be culturally sensitive either to say that. So that can happen during pregnancy. It can happen as well if the muscles are starting to get tight. Postpartum, it depends on how labor and delivery went. Okay, so there's pressure on the muscles for 9 months. Okay, so that can lead to things like leakages and other stuff we talked about. But then labor and delivery itself is straining to the muscles. There might be tearing, an episiotomy, vacuum assisted, other types of things as well. C-section, 9 out of 10 times after a C-section, I see my clients having pain with intercourse after as well, which not a lot of people think about. And they're like, oh, why would I have that after C-section? My theory is that the muscles underneath are just clenching up because they have to compensate now because they went through the abdominal muscles and those have become underactive and weak. So something else has to compensate. So everything inside just goes tight. So if you're experiencing this, if you've had this, pre-pregnancy or outside of pregnancy or during pregnancy and postpartum, please know there is help out there. You don't have to live with pain with intercourse, and we can treat it successfully, especially if there's any scar tissue from tearing and stuff like that. That can honestly just be like massaged out. Okay. So that's a big one I wanted to talk about. The last two things I want to talk about. So one is pelvic organ prolapse. Not a lot of people have heard about this. The second one is abdominal separation, or the technical term is diastasis recti. Okay, so let's talk about abdominal separation first. So I'm just going to show you again a picture, and you should see this pop up soon. So okay, so this is someone standing obviously like facing us and we're looking. So you can actually see there's an indent there that by this belly button especially, where there is that separation, and then the skin is a little bit kind of like wrinkly. The skin being wrinkled, is that an indication of separation or not? I would probably say no, but it can kind of like add onto it because it's a connective tissue that's kind of loosening up. And so a lot of people think about abdominal separation and it's now changed. So if someone's telling you, if you have two fingers in between your abs, that's a separation, please disregard that. That's not really what we're looking for. Okay. What we're looking for is any type of bulging. Okay. Any type of, the other words for bulging are basically coning, doming. If someone is either, doing a sit up, or if they're leaning back, that kind of thing. So there's more pressure in the abdominal area. Or if you feel like you have, and I've had a lot of clients tell me this, that they still look pregnant afterwards. And this is like 4, 6 months, 9 months afterwards. I'm just going to stop the share for that. Okay. And the reason for that is, they might feel okay in the morning, their stomach is flatter. Okay. But then as the day goes on, it gets bigger and bigger and bigger. And it's just because that connective tissue is stretching and stretching and stretching because the muscles are not strong enough to support everything. Okay. So if you're like outside of pregnancy, because I've seen this outside of pregnancy, and you're experiencing abdominal separation, yes, that can be treated. If you're postpartum, yes, that can be treated. During pregnancy, it is common. Okay, there's some studies that show anywhere from 50 to 100% of women during pregnancy have abdominal separation. Okay, that doesn't necessarily mean you're going to have it afterwards. Okay, there are certain exercises we can do during pregnancy to strengthen your core for sure, but don't be too worried unless there's like a hernia or something like that's happening, in which case please go to your doctor. Don't worry too much about it, or don't worry about the 2-finger gap, because my fingers are different than your fingers, different than a male physician's fingers, right? So we don't really go by that way anymore. A lot of practitioners, I think, outside of physiotherapy are still doing it that way, but just something for you to be aware of. So there's a certain way that we actually test for that. Okay. Finally, pelvic organ prolapse. Okay, so usually people have heard about prolapse, so let's just talk about the word. Prolapse means something's coming down, okay? And pelvic organs, the bladder, uterus, bowel, those are the organs that can start to descend, come down towards the vaginal entrance if the muscles are not strong enough to kind of hold everything up and in. 50% of women postpartum have some degree of prolapse. Most people have heard about it as, my mom, my aunt, my grandma, she had to go get a bladder lift. Okay, so if you've heard about that, that was prolapse surgery. Okay, and there's different degrees of prolapse. Okay, so there might be mild and minor, or this is going to sound scary. I'm not here to scare you. Okay, it could also be kind of quite low towards the vaginal entrance, where it can cause bulging, heaviness, pressure, feeling like, if you go to the bathroom and you get up and you walk away, a few minutes later, you have to go again. So there's urinary retention or bowel retention as well. So if that's happening to you, it may be prolapse. It doesn't necessarily have to be. It could be like varicose veins. It could be like other things as well. Okay. But it's just good to be aware of that, just because I see that quite often. And it's something that is just mentally awful for a lot of my clients. I have had prolapse. I actually still live with prolapse. Okay. So I grew up with chronic constipation since the time I was a child, and I was straining. No one told me not to strain. And 3 years ago, I was like, oh, it feels really weird down there. And I was like, oh, I feel like I'm going to pee my pants. So I looked down there and I was like, oh, okay. So I had prolapse. And then I started doing rehab. I started doing physio, right? And I went from being scared of not running or being scared of running and stopping running to now being able to do like basically whatever I want to do. Okay. So just because you have prolapse doesn't mean you won't be able to do all the activities that you like doing. We just need to kind of be aware of and might need to modify what you're doing right now, do strengthening. Okay. And then really what I tend to do is if you're prenatal, we focus a lot on strengthening, and preparing you for labor and delivery. I used to work with surgeons, and they would routinely say, the stronger you are going into labor and delivery, the faster you're going to recover after. Okay. Giving birth is straining for the muscles. Okay. It can be surgery, it can be a C-section, right? So the stronger you're going into labor and delivery, the faster you're going to recover after. And also, we can prevent all these issues from happening or minimize them. Right. So we do a lot of Kegels, and we're going to talk about Kegels in a second. We do a lot of like stretches type stuff. We do hip strengthening, back strengthening, core strengthening, everything in that area so that when you are, at postpartum, then you're already knowing what to do. Because I don't see women postpartum until, about like week 4 to 6 virtually. And within those first few weeks, you already have that exercise plan that we went over during pregnancy. Okay. So let's talk a little bit about Kegels, and I also want to talk about labor prep as well. So let's do Kegels first. So what is a Kegel? Okay, so Kegel is literally a pelvic contractions. That's your pelvic floor closing and lifting up and in. A lot of people are just doing this or this when they're doing Kegels. That's not a Kegel. Okay, if you're just doing that, I would highly encourage trying to kind of like lift up and inwards. Okay, because if you think about preventing prolapse, preventing leakages from happening, that's pressure downwards. So we want to go kind of like inwards instead. Okay, and doing Kegels in different positions is what I usually go through with my clients, depending on their needs. Okay, if you're doing them lying down and you're like, oh my God, I still have leakages, do them standing up, do them, in different positions. Okay. But the big thing with Kegels is Kegels are not for everybody. Okay. Everyone is told to do their Kegels. If you're pregnant, my sister-in-law definitely was told to do her Kegels when she was pregnant. I just highly recommend, consulting at least with a pelvic physiotherapist, because I have worked with physicians and they are generally telling, I think, everyone to do Kegels. If you have chronic constipation, urinary urgency frequency, as well as pelvic pain, those are situations where your muscles might be tight. Okay. And then Kegels are tightening the muscles even further. So you might actually, in that case, not want to start off with doing a Kegel. Okay. You might want to work on kind of like lengthening. And that's what we usually do, working on lengthening the pelvic floor muscles, lengthening the back muscles, that kind of thing. Eventually we do Kegels because it's good to know how to voluntarily contract and relax your muscles and for prevention of all those issues that we listed. Okay. But initially, if you have any of those issues and you're doing Kegels and either it's getting worse or it's not helping, I would say please stop doing Kegels. Okay. So that is my kind of spiel about Kegels. For preparing for labor and delivery. So what do we do? So there's a bunch of different things. Perineal massage, okay, and pushing techniques. Okay, so perineal massage is basically massaging, if you remember that picture I had shown you, massaging the area in between the vagina and the anus. There's a ton of muscle that attaches there. If someone is experiencing or someone experiences a tear, or if there's an episiotomy, usually that's where they do it, and that's where this scar tissue would be. So in that case, we want to make sure we're massaging that area to prevent all those things. Okay, there's different ways of doing perineal massage. It is pretty like specific to the client and the patient, okay, because it depends on if you're going to do it by yourself, okay, or if you're going to do it with a partner. If you're doing it with a partner, that's good. The partner, is going to be doing the massage. You can relax. Okay. If you're going to be doing it by yourself, it's going to be, especially, this is kind of like during pregnancy. I teach massage as well for if somebody has pain, with intercourse or pelvic pain outside of pregnancy as well. In that case, they're usually able to kind of like reach down there with their fingers if it's kind of like deeper, and we get what we call a wand. Or if you're pregnant and you're having issues or postpartum, you can also get a wand. So mine actually just came in the mail, was it yesterday, a couple days ago? Okay, this is gonna look scary. Okay, so don't get scared. Okay, so this is a pelvic wand. Okay, I know it is huge. Wait, which way I'm going? Okay, good. So the whole thing does not go inside. This part is going inside and it's curved for a reason. So it can get into the muscles. Okay. So I'm just going to show you with my arm. If I just do this, yeah, that's good. But if I curve, that is really going into the muscle and that's really relaxing the muscle. Okay. And so we go over different techniques. So with the wand or without the wand, okay, it doesn't matter. This you can get online. So if you're, okay, so it depends. If you're in Canada, so there is a company and a website that I was telling people to go to buy the wands. I think I just sent so many people there over the past few weeks, they sold out. So that's actually the reason that I've gotten the wand. Then I started sending people to the website in the States where they sell wands. They're back ordered now for like, I have no idea for how long. And these things actually cost a ridiculous amount of money. Like on the US website, it's like $60 to $80. It was 55, much more manageable on the Canadian website. So I got this because I wanted to see if this is something that I want to offer at a price that is not obscene. Okay. And I will be. It is for kind of like pre-order on my website for $30. Okay. Shipping is on top of that only, but this is only if you're in Canada. Okay. I haven't really figured out like international shipping and all that stuff. I think, yeah. So if you want to, you can check it out. Okay. If you're going to be doing, if you have pelvic pain, you need to do massage by yourself. If you don't need to do massage by yourself, you do not need to purchase this. Okay. This currently goes for about, I think, $45 on Amazon. Okay. So I'm just doing it a little bit cheaper because I just feel like things can add up during pregnancy as well as postpartum. Okay, so I'll just put that maybe in the chat box. You guys can look at it. If you find something else, go for it. Okay, but it is something, if you choose to order it from my website, just beware. I still have to change this. It says express shipping. You're not going to get it in like 2 days. It's going to take like 2 to 3 weeks for me to get it to you. Okay, so just be aware of that. I'm a physio first, and I'm not used to like doing this online store stuff. Okay, but I will just put that in the chat box for you guys. So you can take a look at that. Okay, cool. Okay, so that is one thing. The other thing we go over is pushing techniques. Okay, so oftentimes women are told to do directed pushing, which is basically holding your breath and pushing. Okay. If you think about that, that does work for some people. I have realized for most people, when they tend to hold their breath, they're actually tightening all their muscles inside. Okay. And so I teach breathing and pushing. Okay. So if you think about somebody lifting something from the ground and then they, hold their breath, they can potentially strain their muscles, okay? Because everything just tightens up. So same thing with during labor and delivery. I just like to provide my clients with different techniques that they can use. And this is just a tool in your toolbox. So we go through, how to do the inhale, how to do the exhale, when to do the push, what techniques to use, what positions, that kind of thing. And then it's up to you. If it feels good, use it. If it doesn't feel good, if there's a different way you like to do, that's fine too. But it's just all about honestly having options. Okay, so that is that. Okay, at this point, I'm just gonna do a quick poll for you guys. Okay, because we're gonna talk about pelvic physio and how it can help. So let's just start that poll. Okay, so have you heard of pelvic physiotherapy prior to this talk? So you can go yes, no, if you did, if you didn't, go for it. Okay, perfect. All right, thank you. Okay, so yes, so pelvic physiotherapy has actually been around for a while. Okay, and it is something that's just not that well known. It's becoming more well known these days. So wherever you are in the world, I would say probably France, it is, in the Nordic countries, it's most well known. Canada's getting better. And I've heard about like other countries, they're also kind of incorporating this as well. But pelvic physiotherapy is basically the assessment and treatment of the pelvic floor area and the core area. Okay. So if someone is coming in and they have certain issues, then we're going through a full history of what's going on. We go through, medical stuff. We go through past medical history, surgeries, falls, injuries, like anything like that, what your current symptoms are. And then after that is an assessment. Okay. Whether it's in person or virtual. Okay. So in terms of virtual physiotherapy, what we're doing is, so after I ask all those questions, usually I have a pretty good idea of what's going on. Okay. Because in school we're taught the history taking part is the most important part. Okay, because when I'm touching the person, that is very subjective. Okay, so if I touch one person, okay, and then a different physio comes in and they touch the person, they're going to feel something totally different. Okay, and it's not a reliable test. So, literally, me getting that information from you first is very, very important. That usually kind of like leads me into thinking, okay, these are the things that are going on, and that leads to the assessment. So, we are assessing the core. So, usually in a virtual session, I'm seeing how the back is moving, how the hips are moving, the strength in the hips, okay, posture, how you're breathing. I might even check how your knees are doing because that is all related to the pelvis, okay? And so all of that gives me a good idea of kind of like what is going on. And then we prescribe exercises. Okay. So that might be, starting with stretching or starting with strengthening. It just depends kind of like on what's going on. If someone has having pain, usually it's starting with a little bit of kind of like stretching kind of stuff, maybe a little bit of strengthening. But if someone is having, like leakages and they don't have pain, then it's more strengthening. Okay. And there's different ways of assessing different parts of the body. Okay. And the biggest question I usually get is, how are you assessing, the pelvic floor? So I have worked at, oh gosh, how many clinics have I worked at? So when I was so right now I'm in Calgary. In Toronto, I was working at 7 clinics. And within that time frame, I was working at a urologist clinic where a lot of elderly people were coming in. Okay. And these people, clients might have issues, getting up to the bed, lying down, even doing an internal exam was just like not possible for them. So what did we do? We took a good history. We went over their concerns. I did an assessment of their breathing, their back, other external areas as much as I could, and I prescribed them exercises based on that, okay, and based on my knowledge of what they're saying in their history and how that correlates with what might be going on in their body. And honestly, most of the time, they were getting better. Probably a couple times I needed to do an internal examination. Other than that, it was really not needed. Okay. And that's where virtual physiotherapy comes in. Okay. And I found that also because I was even questioning myself when COVID happened. I'm like, I don't know. I do internal exams all day. Is this something that I can do virtually? And then once I started practicing, so I'm going to be honest, out of the 100 women, I had one person, and we had like 2 or 3 visits, and she's like, I'm still not improving. I'm still having this pain. So she was having pain and we were doing stretches. And I was like, you know what? Let's just try strengthening and see what happens. Gone. It became better instantaneously. And so in the clinic, I would have obviously known that, but 99% basically out of that sample got better based on everything that I had asked, everything that I had assessed virtually. Okay. So that's kind of what we do. And then within the session, I'm going over a treatment plan, goals. If anybody has any questions, what treatment is going to look like, how many times I would need to see them, because it is very patient specific. There's no kind of like cookie cutter approach. And then sending an email after with treatment, assessment summary, kind of like what we found, treatment plan, treatment goals, and all the exercises that you would need to do. So that is virtual physiotherapy. Okay. If you have any questions, that would be a good point kind of like right now to ask me about them. But generally, yeah, it's been something that is been great to do because people can now access pelvic physiotherapy from home. They might not have a pelvic physiotherapist that is close to them. Okay, so that is for people who are in Ontario and Alberta. If you're outside of those provinces, if you're outside the country, then unfortunately, like I can't give you, a physiotherapy appointment, a physiotherapy receipt. You won't be able to claim that under your insurance. But women's health coaching is something that I do if somebody is outside, and it's a little bit different. So within my scope of practice as a physiotherapist, I can diagnose, I can prescribe exercises. As a women's health coach, we are talking about all those same things, but unfortunately I would not be able to diagnose you. And I am able to provide you with resources. So it's kind of gets like a gray zone. I can give you resources that might help you. Okay. But I can't tell you what to do. It's super weird, but it's just like the decision making is left up to you. I'm here to guide you. Okay. So it's different than going to a doctor, different than going to a chiropractor, different than going to a physiotherapist, where they're like, this is what's happening. This is what you have to do. Women's health coach is like, we are being supportive and here are the resources that might help you. Okay. So in that case, if you're outside of those provinces, that's what I would recommend booking in. If you're unsure, just send me an email. I sent it in kind of like the presentation email as well. Okay. But that's just something to kind of like be aware of. Okay. In terms of virtual physiotherapy, if you're in Canada, is, covered by most insurance plans. Okay. So I would provide you with a receipt, all that stuff. You can submit it to insurance. It is an hour, $185 Canadian for the hour assessment, and then follow-ups are $120 for 30 minutes. Women's health coaching is lower, so it's $145 for the hour and 30 minutes. I think it's $95. Okay, and I'll just put the link here. If you need to talk to me before you book, you can do that as well, kind of like if you have any specific concerns, but I will put that in the chat box as well for you to check out for booking, all that stuff. Okay. Is there anything else I want to say? At this point, does anybody have any questions, actually? Okay, so do you have any questions about the pelvic floor? Do you have any questions about physiotherapy, about signs and symptoms, anything like that for me? Yeah, let me know. I love talking about the pelvic floor and the importance of the pelvic floor and how important it is outside of pregnancy, during pregnancy, as well as postpartum. So I can address any questions right now. Okay, I am going to do another little poll. Okay, so I'm just going to put that out there. So what would you like to learn more about after having attended this session? What is your feedback regarding the session? Is this something, that you would have wanted me to talk about a little bit more, or anything like that, or learn more about? Anything like that, you can let me know. Okay. So you can go for that, and I'm just going to continue talking. In general, for pelvic physiotherapy, I can see women like during pregnancy at any point in time, really. Okay, virtually. Usually, in person, we talk about if we are doing an internal exam, that would be past the first trimester. Okay. And then postpartum is usually around 4 to 6 weeks to check for diastasis, to check for, how the back is doing, the hips are doing, if you have any concerns, that kind of thing. Okay. All right. Perfect. Thank you. Okay. In that case, okay, so that was great. If you have any questions, you can email me. I'll put that email down. Again, it's just crinkling because that's where the wand is. But you can email me at hello@kaya.co. We also have other events coming up. So we have this beautiful event coming up that is to support. It's for holistic care, and I would say I'm always about holistic care. So whether you're, a pelvic physiotherapy client of mine or not, I do tend to talk about, the central nervous system, to talk about, doing other holistic activities for yourself. So I'm just going to share my screen for that. And you should notice a picture come up. So we're doing this beautiful event end of April, for 4 hours. Okay, so it depends on where you're at. I know some people are from the UK. So thank you for waking up really late or really early, however you want to talk about it. So I'm not sure this would be a good time for you to join us. But it is a day of yoga, meditation. EFT is emotional freedom tapping, dance, nutrition, self-expression. It's open to all sexes, all genders, and we are raising money for the Canadian Mental Health Association. Okay, there's a chapter in every state and province of Canada. They do great work in providing, resources and free resources for the general public for mental health, and just empowering us to take care of ourselves. Okay, so that's going to be coming up. You can find that on my Instagram. If you want to follow me at Nav Grewal PT, where I'm going to be posting about that starting tomorrow. So here's a sneak peek. No one's actually seen this. You're the first to see this right now. Okay, so I'm just going to stop sharing. Okay, if there are no questions, then I think we are done. Okay. Yeah, you can send me a message if you want to, an email if you have any personal questions. But otherwise, thank you so much for joining, everyone. And the biggest thing I would say is, if you know someone who has pelvic issues, if you have pelvic issues, regardless of if you don't, I would just encourage you to take care of your pelvic health and maximize your pelvic health. And it's just a part of the body that as women, we often think other people are not talking about. I am here to encourage us to talk about it more, to take care of it, okay, and just be a little bit more empowered with our bodies as well as that area down there. Okay, so thank you again for joining me tonight, and I hope everyone has a wonderful evening. I'm going to have the recording hopefully available in the next few days. If you do want to rewatch it, I'll probably post it on YouTube. Okay, good night, everyone. Take care.